Hi, and welcome back to PhysioTutors. My name is Andreas, and today I would like to show you the Stenvers tests. The Stenvers tests are used in the assessment of the shoulder girdle. The joints that allow the shoulder girdle to work are the sternoclavicular joint, the acromioclavicular joint, the glenohumeral joint, the scapular-thoracic joint, as well as vertebrae C5 through T4. The first Stenvers test can give you an idea about scapular mobility. What you're going to do is you're going to have your patient sit on the bench with the back up straight. Then you're going to go in anti-flexion and hold it up. What you're then going to assess is the angulus inferior of the scapula, and then you're going to check if there is any difference in the alignment of the axillary hairline, so just right here, running down vertically, and then you're going to check, okay, is there any big difference between this line and the line of the angulus inferior? Usually, both of these lines should be aligned. The second test would mainly assess the sternoclavicular joint. For this test, what you're going to do is you're going to place your middle finger onto the clavicle so that I have a pretty big contact surface. Then I'm going to perform passive flexion in the glenohumeral joint. And then you're really looking for the movement of the clavicle under your finger. At about a 45-degree angle, what you're going to feel is that the clavicle will come up and will rotate a little bit forwards. And as I keep going into anti-flexion, it's going to kind of disappear under my finger, so go down again and make a backwards rotation, kind of slipping under my finger as I keep going up into anti-flexion. So you could kind of describe this movement as an elliptical movement. In the third test, you're assessing scapular depression. What you're going to do is you're going to palpate for the inferior angle of the scapula and then ask your patient to perform active anti-flexion. As you follow the movement of the inferior angle, in a healthy individual, you will feel at around about 170 degrees of anti-flexion that the inferior angle will kind of drop a centimeter. In Stenvers test 4, I assess the mobility of the spinal segments C7 till T4, as these segments are responsible for the last few degrees of shoulder anti-flexion from about 160 degrees on. To assess those segments, I'm going to first locate C7, and I'm going to place my index finger on the contralateral side of the spinous process. Then I'm going to perform passive anti-flexion, and what I expect to feel is that the spinous process from about 160 degrees of anti-flexion is going to rotate against my finger here. To assess each individual spinal segment, I can move down, stay in the end range of anti-flexion, and move here. And I'm trying to feel the spinous processes again rotating against my index finger. The fifth test is completely done passively. It can give me information on the posterior capsule of the glenohumeral joint, the SC joint, and the AC joint. What I'm going to do is passively abduct to the arm to 90 degrees, have the elbow flexed to 90 degrees. I'm going to fixate the scapula, and then in a healthy individual, I'm expecting to be able to perform horizontal adduction to about 100 to 110 degrees. And now if I let go of my fixating hand, I would expect another 20 to 30 degrees of horizontal adduction. What I can use as a reference point is that as I perform horizontal adduction, my fist should not fit between sternum and the adducted arm. Okay guys, that was it. Those were the 5 Stenberg tests. Maybe you can use them in your practice. I hope you enjoyed this video. Make sure to subscribe if you haven't. Give this video a thumbs up, and I'll see you next time. Bye.